How you doing today? My name is Tucker Gamble. I'm a student physical therapist. I know you're coming in because you had an ACL reconstruction, and as well you said you're having some issues firing your quad, getting it straight all the way.
Yep.
So today we're just gonna be doing some electrical stimulation to activate your quad, and I'm just gonna turn over here and tell our camera what we're doing a little bit. So the indications for Michael is the patient is he can't fire his quad, so we need to teach him how to activate it. Re-educate the muscle, re-educate the nerves, and as well he has an extensor lag, so that also shows it. His pain is controlled, so we don't have to worry about that too much. And then general contraindications would be if he had like a pacemaker, if he was pregnant, which he's not pregnant, not possible. If he had tumor, skin damage around the area that we were looking at, any decreased sensation, if he had thrombosis, there's a lot of contraindications, but those are just some of the general ones. So basically, I guess the next step that we have is we need to communicate to the patient. So I would then tell Michael, so what we're going to be doing is we're just going to be placing these pads on your quad. And what it's going to do is it's going to force your quad to fire. Okay, it might be slightly painful, slightly uncomfortable, but what we're going to need to do is we want your quad to fire at about like, think of it like if you could fire your quad as hard as you could, we want it to fire about like 60 to 70% of that. So a good, strong, maximal contraction, but not to the point that it's just killing you and it just hurts a lot. Yeah. And what it's going to do is because, I mean, before your surgery, you were able to just move your leg and fire it, work it as much as you wanted to. And right now you're having issues with it. So what this is going to do is it's going to re-educate those nerves so that you'll be able to do that again. So I'm sure it's a little bit of annoying to sit there and not be able to kick it all the way.
And basically move my leg.
Right? Yeah, kind of annoying. So this will help with that so that we can then get back to strength training later down the road so that you can activate it as you need. Okay. So that's what we're going to be doing. So I'm just going to set you up over here. So if I could just have you just lay down with your head right here, have your right leg towards me. I'll help you lift that leg up. Thank you. Perfect. We'll just have you sitting down there. You feel comfortable right there?
Yeah.
I know if he was a real patient, we'd have something else to put under his leg maybe because he can't straighten out very much. So I put a pillow right here. We don't really have all those resources. So just for video's sake, we'd have something under there to make him a little more comfortable. And then we'd come over here. So now he's positioned. We're going to set up the parameters of the machine. So yeah, you can just come right up onto this. So we're doing biphasic pulse. So we click the biphasic. We have normal. For this, just because we're going to be doing 2 repetitions for the video, I'm just going to keep it at 10 out of 10. That means it's on for 10 seconds, off for 10 seconds. In reality, if we'd be doing 10 contractions per day, I'd probably do 1030 or 1050 to get those max. And then the ramp time you can set basically whatever to make it feel comfortable. So I'd start him off at the first visit, probably 2, so he'd get used to it. But knowing Michael, he's had it before. So we're just going to set it at 1 for the sake of the video. The time doesn't matter as much, just because we're going for 2 contractions. The rate, we can set from 50 to 80. So we're going to leave it at 80. And 200 for the pulse width. 200 is basically a minimal for muscle contraction. Right around there is a good range, but you can go higher than that if you need to get a stronger contraction. And then the intensity, like I said to Michael earlier, we want it to be about 60 to 70% of muscle contraction. So from here, we're going to come over here. I'm going to say, okay, Michael, so in order to do this, I'm going to have to place these pads on your quad, just up here, up on your upper thigh. So is that all right if I lift your shorts up a little bit? And in order to do that, I'm going to have to place my hands on your leg as well. Is that okay?
Yeah, that's good.
Okay. Let me know at any time if you feel uncomfortable. Just going to roll this up. Keep away from any sensitive areas. And then we're going to put we got the bigger pads so we can cover most muscle area so that it doesn't awkwardly fire anything. We're going to put 1 right there. Try to hit right at the rectus femoris, right in the middle. And then we go down a good distance, right about there, so we can fire it down there. And then what I'm going to do over here is we're going to be turning up the power and intensity just with this button until Michael reaches that max contraction that we said. For the first visit, you start off slowly so they can amp up to it and feel it pretty good, so it doesn't scare them. But in future visits, you want to hit that pretty quick until they get to it, so their body doesn't get used to the contractions as it's going. So we're gonna come over here to Michael. So Michael, I'm gonna start turning up the intensity. You're gonna feel a little like tingling at first, might get into some pain, and then you'll feel your muscles start to twitch a little bit, and then eventually your muscle is just gonna contract and hold. And we just want that contraction, like I said earlier, to be a max voluntary contraction, which just means basically as strong as you can stand without it just totally hurting. So if it hurts too much at any point, let me know. We'll turn it off, back it off, and we'll get you back down to a comfortable level. But again, it will hurt probably a little bit.
Okay. A little uncomfortable. Okay.
Okay, so I'm going to start turning it up. Let me know when you start to feel any tingling.
Okay.
And while I'm doing this, I'm watching his muscle as well to see if I can see any twitching.
Starting to feel it.
Starting to feel some tingling. Okay. So now I'm really going to start looking for twitching. Michael, let me know when it starts to twitch your muscle. When you start to feel some involuntary twitches there.
Getting stronger, but it hasn't really twitched
Yeah.
yet. Oh, there it goes. It's starting to twitch.
Okay, so now these let me know that it's starting to twitch. I'm going to wait until I can see a full hold of the muscle, and then I'm going to ask him to let me know when it gets to that max. Right there is good?
Yeah.
Okay, so now we know that it's at a good, strong max contraction. So on the machine, I press start, and we're just going to let him go through 2 contractions to help build the strength. So it's going to be on for 10 seconds. You can see his muscle firing, and then it will relax. I'm going to let him know when it's gone through 2 cycles. So after this next contraction, let me know when it stops, and we'll turn it off for you, okay?
Okay.
So it's usually pretty easy to see when it stops, but just in case, I always like to let the patient know. Let me know when it does happen, just in case I manage to miss something. That way we have 2 safety nets. And there's the last relaxation. So then we hit stop, we turn it off. I would then ask Michael how it felt, if there were any problems, if he felt any extra tingling down his leg, any other pain or any other sensations that didn't seem normal to what he's been feeling. If he did, then we'd have to figure it out and probably not do this again. But did you feel any of those?
No, it was...
Yeah. So it felt good, so we could definitely use this as part of this treatment process. And then from here, I'd just say, hey, I'm going to pull these off. It might pull your hairs a little bit, so I'll go fast. And then we'd move on with our treatment from there.